A peer-to-peer study on the psychosocial relationship between individuals with IBD and food. Welcome. We are patient researchers investigating the psychosocial relationship between IBD and food. We will discuss our methodology, findings, and recommendations. We are patients trained in the PACER qualitative methodology. PACER studies are conducted by patients, for patients, and with patients, and are focused on topics important to patients that inform the healthcare system. The PACER methodology follows three phases: set, collect, and reflect. In the set phase, expert IBD patients set the direction of the study based on topics important to them and the IBD community via a focus group. In the collect phase, participants discussed their psychosocial relationship with food and IBD during a focus group and narrative interviews. Data was analyzed using thematic analysis and themes emerged. This chart illustrates participants' journey with food. Participants described a lack of guidance or dismissive attitude from healthcare professionals when seeking help about diet changes, leading them to experiment and research on their own. Additional stressors like stigma, flares, and mental illness often exacerbated their stress. Participants noted that gains in experience and knowledge helped evolve their relationship with food over time and eventually arrived at a new normal of acceptance and hope. To summarize, participants experienced numerous psychosocial challenges as they navigated diet and noted gaps in knowledge and support from healthcare providers. This was a significant trigger of stress on top of changes in their diet, feelings of isolation, and emotional distress. Our group conceptualizes the patient journey with food as whitewater rafting. The people in the raft symbolize the patient and their support team. The water is a metaphor for IBD. Patients have little control over it and no knowledge of what lies ahead. Weather, rocks, and rapids will impact their experience. These symbolize flares, stigma, emotions, and stress over constantly changing food intolerances. The more experience and knowledge patients have, the more effectively they are able to navigate future rocky waters. In the reflect phase, participants further refined themes and made recommendations for healthcare and policy change. Here is the list of recommendations our participants had for healthcare providers and decision makers. These include creating a working group of healthcare providers and patients to create diet experimentation guidelines, training healthcare providers about the significance and psychosocial impact of diet, and sharing patient stories about food experiences to support and inform patients, especially those who are newly diagnosed. Thank you for joining us. Please visit the link above to learn more about our project.